This is a case of pregnancy at 34 weeks of gestational age. The patient is poor and came from periphery, and this is her first ultrasound. Most of the poor patients from villages start their first treatment and checkup in 8th month. The first thing we noted in the ultrasound is a grossly increased amniotic fluid. Amniotic fluid index is measured in all 4 quadrants. This is 33.4 centimeter. This is grossly increased. There are many maternal causes of increased amniotic fluid index and congenital abnormalities of the baby. This is a brief look of the anatomy of the baby to find the cause. There are multiple congenital syndromes that cause increased amniotic fluid. But anywhere obstruction in the GIT tract of the baby is one of the most important cause of grossly increased amniotic fluid. Now we can see that fetal head, brain, lips, eyes, spine, limbs, fetal stomach, everything is normal. There is no dilated bowel loop segments. Fetal chest is normal. This is a male baby. But in the transverse view, when the abdominal cavity is seen in the transverse view, we can see a bulge from the hyperchoic bulge from the umbilical region. This is of size 34 millimeter. This is in midline. An umbilical cord is seen posteriorly in the bulging mass. These are not free-floating structures. This is covered with a membrane. This is a case of omphalocele, a congenital midline abdominal wall defect at the base of the umbilical cord insertion with herniation of gut and rarely other structures out of the fetal abdomen. The organs are covered by a thin sac. It can be diagnosed by ultrasound as early as after 12 weeks of gestational age. Now, what can be the outcome or prognosis of the baby? If omphalocele is the only problem of the baby, there may be the full recovery. But if there are associated other syndromes, the prognosis may be poor. There are multiple congenital anomalies associated with omphalocele. These most important of these are trisomy 18, 13, 21, Turner syndrome, fetal CNS abnormalities, fetal cardiac anomalies, and fetal renal tract anomalies. Is there any cause of the omphalocele? Most important cause is a change in gene or chromosomes. However, there are some other factors that increases the risk of baby with omphalocele. These are alcohol and tobacco intake, medicines like antidepressant during pregnancy, and obesity.